Welcome in today's discussion of anemia in pregnancy. My name is Dr. Solomon Oguta from Gulu University. Anemia is defined by World Health Organization as reduction of circulating hemoglobin of less than 11 grams per deciliter and or reduction in hematocrit by less than 32%. Anemia is graded by the degree of hemoglobin concentration in the blood as mild anemia when the hemoglobin level is between 9 to 10.9 grams per deciliter, moderate when hemoglobin is between 7 to 8.9 grams per deciliter, severe when hemoglobin is between 4 to 6.9 grams per deciliter, and very severe when hemoglobin is less than 4 grams per deciliter. Dose grading determines the complication that may happen during pregnancy. There are several factors that can predispose to development of anemia. Basically, we are going to look at two main factors, that is being physiological factors and acquired factors. Physiological factors, these are changes that take place during normal pregnancy and which is normal in every pregnancy. It is well assured that when the pregnancy is developing, there are maternal changes that take place. For example, the plasma volume or the blood volume increases by about 50% of the normal volume. Yet, the level of red blood cell increases by only 25%. This makes the body have a situation of hemodilution that will lead to reduction of hemoglobin level, reduction of red blood cell level, and reduction in the hematocrit. That can predispose to anemia. Okay, so that is one of the factors that can cause anemia in pregnancy. There can also be increased requirement of folic acid, that is, it increased by 10 to 20 folds during pregnancy, as well as iron requirement that increases by 2 to 3 folds during pregnancy. So, when the mother is not eating well or is not getting the supplementation of folic acid and iron during pregnancy, this mother will be at a risk of getting anemia. Under nutritional requirements, there is deficiency of iron. Iron deficiency can lead to anemia, what we call iron deficiency anemia. Another acquired cause is macrocytic anemia. Macrocytic anemia is anemia that developed when the mother is having the deficiency of folic acid and or vitamin B12, because those nutrients are much more important in the production of red blood cell. In the situation whereby the mother is having the deficiency of vitamin B12 and folic acid, the mother will have macrocytic anemia. Also, there can be dimorphic or protein deficiency anemia. These ones result from the combination of deficiencies of folic acid, vitamin B12, and or iron. Other causes are hemolytic anemia. Hemolysis can take place due to infections like malarial infection can break down red blood cell, or other hemoglobinopathies like thalassemias or any other infection can lead to red blood cell breakdown. These two can lead to development of anemia. Also, there can be hemorrhagic causes whereby the mother is losing blood. For example, if the mother is having chronic hemorrhoid or hookworm infection, those one can lead to hemorrhagic anemia. That is why it is important for mothers during the antenatal visit, they are given the deworming tablets, albendazole or mebendazole, to treat these hookworm infections. The risk factors of development of anemia, apart from those causes, could also include socio-demographic characteristics, for example, maternal age. Extreme maternal age is associated with anemia, as well as level of formal education, marital status, and place of residence. Also, there are obstetric causes, for example, the number of pregnancies that a mother has ever had, high parity level or increased number of pregnancy is associated with the development of anemia. Others could include the history of preterm delivery or low for age gestational delivery in the previous pregnancy can also indicate the possibility of development of anemia in this pregnancy. Other risk factors include behavioral factors, for example, smoking or tobacco use during pregnancy, alcohol usage, and underutilization of preterm care services. Medical conditions including hypertension and diabetes mellitus, and the development of anemia in the previous pregnancy. Those ones can give us the clue of the possibility of happening of anemia in the current pregnancy. Anemia has serious effects in pregnancy. It affects both the mother and the fetus. On the mother, anemia may result in the development of cardiac failure, what is called high output cardiac failure. This happens because in anemia, there is low supply of tissue with oxygen. And in this situation, there is going to be increased demand for flow of blood to these tissues. And it's going to put the workload, the heavy workload onto the heart to pump this blood into the tissues. So, as it happens in the long term, it's going to put this heart under the risk of developing the state of failure. On the mother, there can also be possibility of postpartum hemorrhage immediately after delivery. This one is owing to low supply of oxygen and hemoglobin into the myometrium. Myometrium is the muscles of the uterus. So, when there is low supply of oxygen and hemoglobin into the uterus, it's going to lead to the dysfunction of the enzymes and the contractile mechanism of this muscle that will prevent it from contracting immediately after delivery. Because the uterine contraction is very much paramount to control bleeding immediately after delivery. In a state whereby it is not contracting properly, the mother will end up with too much bleeding, what is known as postpartum hemorrhage. There can also be development of infections and delayed physical recovery, especially after the cesarean section. To the fetus, anemia may cause the effect of intrauterine growth retardation. The baby may not develop normally as it is supposed to be because of the anemia. There can also be the possibility of preterm birth, low birth weight, and delayed cognitive function even after delivery when this baby is delivered. So anemia is not good. It is important to check what could be causing the anemia, and we control them because they have the devastating effect both to the mother and the fetus. Clinically, mothers who may be having anemia may present with the following symptoms. But in the first place, most of the women don't show the signs and symptoms of anemia because of the normal physiological adjustment of the body that takes place to compensate for the changes that has taken place during pregnancy. So that one may try to cover the sign and symptom of anemia and will make the sign and symptom not to be very well clear. Okay? And the mother may present with the vague symptoms, which include ill health, easy fatigability, loss of appetite. There may also be digestive upset, difficulty in breathing, or palpitations. So when you start experiencing those signs and symptoms, it is better to visit a healthcare facility or call your healthcare provider so that you can be cross-checked, you can be examined and investigated. During the examination, the healthcare provider may note the following signs that is owing to anemia in pregnancy. There may be pallor of the face, the hand, and the mucous membrane of the conjunctiva. On the nail may look brittle, straight, and loss of luster. There may also be angular cheilitis and glazed tongue. In the situation of severe anemia, there may be edema and signs of cardiac failure. Not all those signs and symptoms may be present, so in case you see yourself not feeling well, it is important to visit the healthcare facility so that you can be cross-checked and examined and then investigated. There are so many investigations that the healthcare provider may request depending on his or her physical finding. And the management will depend on the above parameter. The complications of anemia in pregnancy include low birth weight, whereby you're going to deliver your baby with the weight which is not normal for the normal deliveries. There may be increased chance of neonatal infections, also preterm labor, increased risk of spontaneous abortion, postpartum hemorrhage, this is increased bleeding after delivery, prolonged labor, and increased maternal mortality rate. So those complications, some of them are not compatible with life, but it can be prevented if we detect anemia early enough and we treat them. There are the universal measures that has been put in place by both the World Health Organization and the government of Uganda to counteract the anemia in pregnancy, which include the folic acid and iron supplementation during pregnancy. This one is given. It is a must for every antenatal visit that you are given the folic acid and then iron. Because we have looked previously that there are the nutritional deficiencies, including folic acid and iron, that predispose to anemia. Other one also includes supplementation and fortification of our local food with micronutrients that can also prevent anemia. Control of malarial infection by use of the Fancida. It is a routine for all the antenatal care. And then also the control of the hemorrhages. For example, the one which is being produced by the hookworm, the mebendazole and albendazole are given to treat the hookworm infections. All those are to counteract the effect of anemia in pregnancy. Thank you so much.